Good evening, I'm Shameka Neely. Officials from INDOT Thursday gave the public an idea of how the proposed stretch of Interstate 69 between Bloomington and Martinsville could look. WTIU's Dan Goldblatt has the story.
Morgan and Monroe County residents came out to INDOT's presentation at the Monroe County Fairgrounds to see how the interstate's design could affect them. Bloomington real estate agent Jason Millicent says many of his clients have been asking about the proposed plans.
Businesses are very concerned on the interchanges, obviously, because if they don't get a good interchange, that could, affect their business. People that own their houses are concerned with their house values, obviously, because if it's too close to an interstate, it may be a tough time to sell.
Millicent says while some of his clients look forward to ease of access to the road, others are worried about losing land and wildlife habitat. INDOT spokesman Will Wingfield says Thursday's meeting was one chance for the public to weigh in on the proposed plans, but there's still time to voice an opinion.
There are things that people who live along the road know better than anybody else. We want to hear that information so that we can do the best environmental document and then the best design we possibly can.
At the meeting, both curious residents and vocal road opponents considered large printouts of the proposed plans. I-69 officially opened from Evansville to Crane last month, but a spokesman from the Hoosier Environmental Council says the group is still working to prevent any further construction on the interstate. For WTIU News, I'm Dan Goldblatt.
Brown County's health clinic isn't fulfilling the needs of the community as a whole. The finding of a group of graduate students in Indiana University's Kelley School of Business, which has spent a semester studying the issue. Brown County wants an all-inclusive health center that is federally funded to help serve more uninsured patients. Bill Todd leads an advocacy healthcare group and says the county can also work with primary care physicians in Bloomington and Columbus, but convenience is also important to residents.
I would be in favor of collaborating with the existing facilities and working with the state in their funding sources to come up with a comprehensive model rather than just a piecemeal model.
Todd says Brown County's doctor-to-patient ratio is about twice the state average, with more than 1,600 patients to each physician. Taylor Cates, one of the Kelley School students who study the county's health issues, says since Indiana University Health took over management of the clinic, the numbers of both patients and patient visits have dropped.
It's not meeting the standards that were originally set by the county as far as hours of operation. The clinic right now is open 3 days a week, and I think we calculated it, and the average visit per day is 2.2 patient visits.
The study's recommendations include having a more community-based and wide-ranging community wellness center in order to attract more primary care physicians to the area.